Alyssa Christiansen. I'm going to be your provider today. Can you just confirm for me your full name?
Samuel Palmer.
All right, Samuel, nice to meet you. And then can you confirm for me your birth date?
It's March 7th, 2003.
Awesome, perfect. Okay, well, just kind of to get started, I'm just going to explain what we're going to do. To start off, I'm going to take some vital signs, okay? We're going to start with blood pressure. Have you ever had your blood pressure taken before?
No.
Okay, well, I'll just kind of explain to you what we have here. So this is our blood pressure cuff. Basically what I'm going to do is I'm going to be putting it around your arm, just your upper arm.
Yep.
And then we're just going to basically cut off the circulation there for just a little bit. And then as we release it, we're going to be able to hear what is called your systolic and your diastolic blood pressure. Basically what that means, the systolic blood pressure is the pressure that comes from your ventricle and your heart contracting. So that's when your heart contracts, okay, pumping the blood. And then the diastolic pressure is our lower number, and that is basically when the heart is relaxing, so blood is not being pumped. Does that make sense?
Yes.
Perfect. Okay, so I'm going to start by doing that. Basically what we're going to do is we're going to be putting it just on your brachial artery. So if you can just put your arm up here on the table. Perfect, just like that. Okay, and then I'm just going to put this around up here. Okay, and then this is kind of just going to tell me those numbers. So if you will hold that. Okay, so it's just going to be a tight squeeze, and then it'll release, okay?
Yep.
Okay, awesome. So I got 106/72. Okay. So I'll just kind of explain to you the different levels of what we have when we're talking about blood pressure. So hypotension basically means low blood pressure, and that is when it's 90/60, and that's really bad. But yours was above that, right? Yours was in a more healthy range, a little bit lower than normal.
Yeah.
Normal is 120/80, okay? And then we have a whole bunch of levels of hypertension or high blood pressure. So if it's elevated, then it's going to be, as we see here, between 120/129. So your ventricle has a little bit more pressure as it's contracting, but it's still over 80 at rest, which is good. And then hypertension is when we have between 130 and 139, and then the diastolic is a little bit higher than 80, okay? And then that's just stage 1. Hypertension stage 2 is when we have greater than 140/90, and that's getting into more dangerous levels. And then when we reach hypertensive crisis, that's when it's 180/120 or above that, and that's really, really dangerous, can be fatal. So basically when we're talking about hypertension, it's caused by a lot of blood pressure, usually something that diet can fix. We also have medicines that are able to lower blood pressure. And then decreasing salt intake is a big thing in that as well, because that will lower the blood volume. If we're talking about low blood pressure, that's something that is able to be increased as we increase our blood volume. So increasing water as well as increasing salt intake. Those are both ways that we can kind of handle low blood pressure. And then exercise, of course, is always important in maintaining a good blood pressure. Does that kind of make sense?
Yeah.
Perfect. Do you have any questions about blood pressure or the way that we take it or what it stands for?
I don't think so.
Okay, awesome. Perfect. Well, then we'll just continue on and get some of your other vital signs and then move forward, okay?
Okay.
Perfect.